I would say it's the best thing that's ever happened in my life. I'm telling you, when a person can't breathe, they feel like they're suffocating. There's no more joy that I have knowing that I'm 60-70% better already. It started around 3 years ago. I had pneumonia. After the pneumonia, around 2 or 3 weeks, I got over that, but then I noticed a shortness of breath. And then after, I started going to the doctors, of course. Wife being a nurse kind of forced me to go. They sent me to a pulmonary doctor, and they ran all these tests, and he diagnosed it as Parsonage-Turner syndrome because my left side of my diaphragm was paralyzed. I dealt with that for about 1.5 years, dealing with it with no BiPAP machine or anything. It got worse, so one day I had an appointment with the pulmonary doctor. He did a test on me, and he said, "You're going to have to go to the ER." And so they did these ultrasounds, different things they did, all these tests. My lung had moved up above my breast line up here, and the lung on this side moved up, and my diaphragm moved up. So they just said, go home with steroids and the BiPAP, and maybe it'll get better. Well, as a paint contractor, I climbed a lot of ladders, and I tried to file disability because I could not work. I could not lay down. I could barely sit up, could barely breathe. So my wife, being a nurse, as she is, she got online and started corresponding with these people up here in New Jersey and seeing what they could do. My goal was, at the time, if I could breathe 50% better than what I was going through, it was a big help. I was willing to just get half of it working, whatever it took. And once I found out that he could do it, I had no hesitation. I wasn't nervous, I wasn't worried about it. I just knew that based on what I've seen and heard, I knew he could do it. And he did. He did a nerve transplant or bypass on my right side of my neck. And got that done, and he said it'd be 10-12 months before it actually take effect. Within 5 months, I was off my BiPAP machine. I didn't need it. I don't work every day, but I can climb ladders without being tired or breathless and all that. So I'd say with anybody out there that's having this surgery or debating on deciding to do it, they will never regret that choice, because it is a choice. You have to make that choice, but I made that choice, and it was the best thing that ever happened to me, because I'm a new man. And I'm almost 65 years old, so there's hope.